Understanding acute lymphoblastic leukemia. All causes, signs, symptoms, and treatment. Acute lymphoblastic leukemia, ALL, is a type of cancer that originates in the bone marrow and affects white blood cells called lymphocytes. This aggressive form of leukemia is most common in children but can also occur in adults. Here's a comprehensive look at the causes, signs, symptoms, and treatment options for all. Causes of acute lymphoblastic leukemia. All. 1. Genetic factors. Chromosomal abnormalities. Changes such as the Philadelphia chromosome are linked to all. Inherited syndromes. Conditions like Down syndrome, Fanconi anemia, and neurofibromatosis increase the risk. Family history. Rarely, a family history of leukemia can be a factor. 2. Environmental factors. Radiation exposure. High levels of radiation, such as from previous cancer treatments or nuclear accidents, can increase risk. Chemical exposure. Contact with chemicals like benzene is linked to a higher incidence of all. Viral infections. Certain viruses like the Epstein-Barr virus are associated with increased leukemia risk. 3. Previous cancer treatments. Chemotherapy. Previous treatment with certain chemotherapy drugs for other cancers can elevate the risk. Radiation therapy. Prior radiation treatment can contribute to developing all. 4. Immune system. Weakened immune system. Individuals with a compromised immune system due to certain medications or conditions may have a higher risk. Signs and symptoms. 1. Bone marrow suppression, anemia, fatigue, pallor, and shortness of breath due to a lack of red blood cells. Leukopenia. Increased susceptibility to infections due to a lack of healthy white blood cells. Thrombocytopenia. Easy bruising or bleeding due to a low platelet count. 2. Systemic symptoms. Fever. Persistent fever without an obvious infection. Unexplained weight loss. Significant weight loss without dietary changes. General malaise. A general feeling of discomfort, illness, or lack of well-being. 3. Bone and joint pain. Bone pain, tenderness, or aches in bones and joints. 4. Swelling in enlarged organs. Lymphadenopathy. Swollen lymph nodes in the neck, armpits, or groin. Hepatosplenomegaly. Enlarged liver or spleen causing abdominal swelling or discomfort. 5. Neurological symptoms. Headaches. Persistent headaches, sometimes accompanied by vomiting. CNS involvement. Neurological symptoms such as seizures or blurred vision if leukemia cells spread to the brain or spinal cord. 6. Skin and gums. Petechia. Small red spots on the skin due to bleeding under the skin. Gum enlargement. Swollen or bleeding gums. Treatment. 1. Chemotherapy. Induction therapy. Intense treatment to achieve remission by killing as many leukemia cells as possible. Consolidation therapy. Follow-up treatment to destroy any remaining leukemia cells. Maintenance therapy. Lower dose treatment to keep the disease in remission over a longer period. 2. Targeted therapy. Tyrosine kinase inhibitors, TKIs, drugs like imatinib for Philadelphia chromosome-positive all. Monoclonal antibodies. Drugs like blinatumomab that target specific proteins on cancer cells. 3. Radiation therapy, CNS prophylaxis. To prevent leukemia cells from spreading to the brain and spinal cord. Localized radiation. For specific areas affected by leukemia. 4. Stem cell transplant, allogeneic transplant. Stem cells from a donor to replace the damaged bone marrow. Autologous transplant, using the patient's own stem cells after high-dose chemotherapy. 5. Immunotherapy, CAR T-cell therapy, genetically modified T-cells to recognize and kill leukemia cells. Immune checkpoint inhibitors, drugs that help the immune system attack leukemia cells. 6. Supportive care, infection management, antibiotics, antifungals, and antivirals to prevent or treat infections. Blood transfusions, to treat anemia or low platelet count. Growth factors, drugs to stimulate the production of white blood cells. Acute lymphoblastic leukemia, ALL, is a fast-growing cancer that requires prompt diagnosis and treatment. Understanding the causes, recognizing the signs and symptoms, and knowing the available treatments can significantly improve outcomes. Regular follow-ups and supportive care are crucial for managing the disease and enhancing the quality of life for those affected. Stay informed and proactive in managing ALL for the best possible outcomes.